So you have a swollen eyelid. Chances are you're doing one of two things. Either you're Googling worst case scenarios in full panic mode, trying to figure out what this could be, or you are not worried about it, just going to put a warm compress on it and it will go away on its own. And chances are you're right not to be in full panic mode. But there are a few specific signs that means your eyelid swelling should be seen today. And what are those signs? Well, most people don't know what these signs are. So we're going to go over exactly what they are, how serious it is, and when you should actually go into your doctor. Let's focus in. Now, swollen eyelid is probably one of the most common things that we see on our clinic, and the causes can have such a wide range. It can range from getting better on its own within a few days, maybe a week, all the way to being more urgent that you need to be seen right now because it's that serious. And the frustrating thing is the swollen eyelid can look really similar at first. So this is what we're gonna do in this video. We're gonna go over the most common causes of eyelid swelling, most likely what you're dealing with, but I'm also gonna go over 4 specific red flags that you need to look for, because if you have one of these or multiple, then it's more serious, more urgent, and you need to be seen. The number one, probably the most common cause, is the good old classic Stye, also called a hordeolum. The best way to think about this is pretty much a pimple on your eyelid. This is a small blocked or clogged oil gland right near the eyelash, the base of the eyelashes, and the result of what you get is this red, tender, kind of painful, swollen eyelid. And depending on how inflamed it is, it can also cause the whole eyelid to look inflamed as well. Now, the good news is most of these styes or hordeolum will resolve on their own within maybe a week or 2 weeks, and especially can resolve even faster if you are able to do warm compresses near the beginning of when it first starts showing up. But on its own, this is not a medical emergency. Number 2 is something called a Chalazion, and this is really similar to a Stye or hordeolum. This is also a blocked oil gland, but more specifically some of the long meibomian glands that are inside of the eyelid. And because it can block one of these long oil glands, a lot of times people get this kind of bigger bump that's up the eyelid a little bit and just looks like some kind of lump that's starting to show up on the eyelid. Now, the big difference is this is not infected like a Stye is. It's more inflammatory in nature. It can still be a little bit tender, but you usually don't have this hot, red, angry eyelid like you get with a Stye. Now, the downside to a Chalazion is that it can stick around for a while, sometimes weeks, months, sometimes 6 months. Can be a real hard little pebble that just seems to stay in there for a long time. Now, these can be harmless. Sometimes it can get big enough that it presses on the eyeball a little bit and it induces some astigmatism or changes the vision a little bit, so some people will get blurry vision. And you'll want to go into your eye doctor to kind of figure that part out, but most of the time, this is not an urgent or a medical emergency to go into your eye doctor. Now, I have done more specific videos about a Chalazion or a Stye, where I've gone into more detail about the protocol and possible treatments, maybe home remedies. If you want to check that out, I'll put the link in the description. So I think those are worthwhile to watch if that is something you're dealing with. Now, this next one also might be really common, maybe rivaling Stye hordeolum of what we see in the clinic, and that is allergies or an allergic type of swelling. This can be triggered by pretty much anything. It could be pollen, dust mites, seasonal allergies, pet dander, can be triggered by contact lens solution, contact lens material, eyelash extensions, eyelash glue, or in more severe cases, maybe foods can cause your eyelids to swell. Now, usually the hallmark of an allergic swelling is both eyes are usually affected. You might have one eye that might be a little bit more than the other one, but usually both eyes are affected. I have seen where just one eye has been affected and someone's, maybe if that eye got some pet dander or pet hair in there, that eye just kind of goes bonkers. But if your eyelids are kind of puffy, swollen, and you have this chronic need to want to rub them and they're itchy, then yeah, allergies should be on the top of your list. Even if you don't have normal allergies and this is completely out of the blue, sometimes these can surprise you. Now, this kind of eyelid swelling, allergic swelling, is something that we call allergic blepharitis and can most of the time be managed with maybe antihistamine, eye drops, maybe Benadryl, oral antihistamine medications. But if it keeps coming back or doesn't really fully go away, then you definitely want to go in and check with your eye doctor. But most of the time, not urgent, not a medical emergency, and can be managed with home remedies. Now, the other one is something called blepharitis. This is just the inflammation of the eyelids. Now, typical blepharitis is usually localized right around the base of the eyelashes or the eyelid margin, and can inflame the edge of the eyelid and cause it to be kind of a chronic red, maybe irritated looking, swollen. Can also cause this irritation, maybe some crusting around the eyelashes. And this can be caused by bacteria or something called Demodex mites, which are little mites that can live on the eyelids and in the eyelash follicles. And I did a whole video specifically on that because it can be more common than you'd think. Definitely check out the video in the description. And this is something that's not typically an emergency, but can be kind of a chronic issue and can cause meibomian gland problems, dry eye issues if left untreated. And so this is something that you might want to go to your doctor about, at least eventually, to really get down to the core issue. Okay, so now let's get a little bit serious here. So those 4 things that I mentioned, Stye, Chalazion, allergies, blepharitis, those are all manageable and not urgent, and likely that's what you're dealing with. But I want you to pay attention to these 4 red flag signs, because if you have any of these, you might need to be seen more urgently, and you'll want to tell your eye doctor about this so that you can get treated properly. Number 1 is a fever. Now, a fever usually means that your body is actively fighting off an infection. And if you have a fever accompanied with eyelid swelling, then this infection could be in a place that you do not want it to be, and you want to get ahead of it before it goes somewhere else, maybe towards the brain. And so this is an urgent situation. Number 2, and this is one that not a lot of people know about, but really needs to, and that is pain when moving their eyes. There's a common phrase that a lot of eye doctors will either put in their chart or say when they're talking to other doctors, and they'll say pain with eye movement or no pain with eye movement, just to clarify kind of what we're dealing with. And there's a specific condition that we're trying to classify here, and something called orbital cellulitis. This is not your typical eyelid infection where your eyelid swells up. This is an actual infection that can get behind the eye and can pass an anatomical barrier called the orbital septum. Now, the reason why this is scary is not only will it have an infection behind the eye, can compress the optic nerve, cause serious eye problems and vision problems, but that infection has now a direct path to your brain. So if you have eyelid swelling and your eyes hurt when they move left, right, up, down, any direction, then this could be an urgent medical emergency, because this is something that you want to catch as fast as possible. Someone will go into the ER, and if they're thinking orbital cellulitis, they'll put that patient on IV antibiotics to try and get rid of this infection to save the brain and save whatever is behind that septum. Now, an orbital cellulitis is not common and likely not what people are experiencing with their eyelid swelling, but it is the one that I want people to know about, because if they do have this sign, then I don't want them to wait, because if they wait too long, it can cause serious damage. So yeah, this is an important one. Number 3 is vision changes. Now, any type of vision change, kind of like what I mentioned previously, that maybe a chalazion can get big enough where it starts pushing on the eye a little bit, causing a little bit of induced astigmatism and blur. Yeah, you want to go into your eye doctor to try and address this. Now, there can be other vision changes that can happen. Double vision, blurry vision, spots or blots in your vision, and different things can be affecting this. And so yeah, any type of vision change, just best go into your eye doctor, get it checked out. And the 4th one is rapidly spreading swelling. And we're not talking about, ooh, my top eyelid really did swell up fast. We're talking top eyelid, bottom eyelid, and maybe is now sinking or going into other tissue, maybe the top of the cheek, or maybe going onto the side of the face. It's getting red and swollen. This is where it's getting rapid, and this is not your typical stye. This could be something called a preseptal cellulitis, and this is something that would need antibiotics. It can also be a severe case of an allergic reaction as well. Either way, this needs to be seen, and you need to go in there fast. Now again, the majority of eyelid swelling will be covered under those 4 common ones that I mentioned earlier. But if you do have any of these 4 red flag signs, don't waste your time. go in there today. And again, like I said, I have more dedicated specific videos about Blepharitis, Stye, Chalazion, best warm compresses, allergies, pink eye. And so if you want to go into more detail and learn what you can do, maybe some home remedies that might help, check out that playlist right there. Or if you have any comments or questions, leave them in the comment section. I'll try my best to answer them down there. Hopefully this video helped. Stay focused.